Meanwhile, the United States Surgeon General has issued a new advisory this morning warning about the adverse effects of social media on our younger population. According to the Department of Health and Human Services and the Surgeon General, nearly half of the teenagers they spoke to say social media makes them feel worse about their body image. Over 60% say they are exposed to hate-based content on social media, either often or sometimes. And nearly 75% say social media apps and sites are only doing a fair to poor job of addressing online harassment. Joining us now, U.S. Surgeon General Dr. Vivek Murthy.
Thank you so much for being with us, Mr. Surgeon General. So tell us about your Surgeon General's advisory over social media and the mental health of youth in America.
Well, we're living in the middle of a youth mental health crisis in America. And I've said before, this is the defining public health issue of our time. And the reason I'm issuing this advisory is I am very concerned now that social media is an important factor that is driving this youth mental health crisis. You know, I talk to parents all across the country, and the most common question that they ask me is social media safe for my kids? And the truth is, when we look at the collection of publicly available evidence, when we talk to researchers and subject matter experts, we can't say that social media is, in fact, safe for our kids. And in fact, what we do see is growing evidence of harms. And specifically, you think about the fact that kids who use more than 3 hours of social media a day face a greater risk, in fact, double the risk of depression and anxiety symptoms. This is especially concerning when you consider the fact that the average amount of use by kids is 3.5 hours a day. So the bottom line is, this is a real point of concern here. When nearly half of kids are telling us that social media use makes them feel worse about their body image, I think about that as a father who has 2 young children. And I want what every parent wants. I want my kids to grow up confident, to grow up feeling good about themselves. I want them to be able to thrive. We should make sure that social media is, in fact, a place where our kids get benefits and where they're not harmed.
So what does an advisory do at this point in terms of spreading the message? I think a lot of parents are living the message, and social media has become a part of the fabric of young people's lives. It's not something, as a parent, you have a lot of power over. You have some, but you don't have a lot. And in other cases of things that were dangerous toward children, there were regulations or laws or bans. They can't smoke. They're not supposed to smoke cigarettes. They're supposed to wear a seatbelt. They can't drink alcohol till a certain age. What's the solution here, and what does this advisory do?
And what should parents do?
Yeah, they're really good questions. And I'm glad you brought up parents, Mika, because parents are in a very difficult situation here. And I hear this from parents all the time. They are having to deal with a technology that is rapidly evolving, that is pervasive. Around 95% of kids are using social media. A technology that fundamentally has changed how our kids look at themselves and each other in the world, but a technology that prior generations never had to deal with or contend with or manage. So parents are in a very difficult situation. What I worry about, Mika, is that we have largely put the burden of managing social media on the shoulders of parents and kids. And now what they find themselves is pitted against some of the best product designers in the world who have designed these platforms to maximize the amount of time that kids spend on these platforms. So what I care about as Surgeon General, as a doctor, as a dad, is not the amount of time kids spend. I care most about their health and their well-being. That's what we should be seeking to optimize. What this advisory does is, number one, it helps parents understand what the data tells us about the mental health impact of social media on our kids. But it also calls to action policymakers, technology companies, researchers, and others, and lays out concrete actions that they can take. And finally, consider this. You know, Mika, you mentioned other places where we look to support parents, you know, in making decisions and keeping their kids safe. Like, you think about cars. We don't tell a parent of a 15 or 16-year-old who's about to start driving, you know what, you figure out whether the car is safe on your own. You figure out what tools and sort of safety provisions and features it needs. We establish safety standards, and then we implement them and enforce them. That's what we need policymakers to do here, because this is too much to place on the shoulders of parents alone.
Dr. Murthy, good morning. When that CDC report came out in February, it dropped the jaws, I think, of a lot of parents that showed especially teenage girls, young girls, 60% or something like that have feelings of persistent sadness and hopelessness. And we talked about suicidal ideation, all these things that just break the heart of anybody who read that study. Is there any doubt in your mind that this huge spike in that is directly linked to the proliferation of social media?
Well, I'm issuing this advisory because I'm really concerned that it is, in fact, linked. But there are open questions that we've got to answer here. And part of the challenge that we've had in getting answers to all the questions we have about the full extent of social media's impact, who's at greatest harm, what the mechanisms of harm are that researchers have not been able to get all of the data that they need from technology companies. It's something I hear all the time from researchers around the country, and that's something that has to change. Look, I recognize that some of the companies have been working to make the platform safer, and that's a good thing. But it hasn't been enough, and we need to move faster. Social media has been around for 20 years, yet I have not yet seen in all the publicly available evidence we have looked at that there is clear evidence that this is, in fact, safe for our kids. And that's really what parents are asking for. I think it's a very reasonable ask. And finally, Willie, consider this. You know, the other day I came home and my wife and I were talking to our daughter, who's 5 years old and is in preschool, and she asked us about posting a picture on social media. She's 5 years old. She's in preschool. We don't talk to her about social media, but her classmates are talking about it. This is pervasive. It is everywhere. And that's why it's so important that we support parents. You know, I'll tell you what we're doing for our kids. As our kids get older, you know, our goal is going to be to delay the use of social media until after middle school, recognizing that is easier said than done. And we're going to need help. So we're looking for other parents that we can partner with who might take a similar approach to their kids because there's strength in numbers. But for parents out there whose kids are already on social media, a couple things I would offer. One is to start a conversation with your children about social media, about the benefits, about the harms, but also about when they should be worried, if they're being harassed or bullied, as so many kids are. But also recognize there are certain areas in your kid's life that you want to protect. Their sleep, their in-person time with others, and their time for physical activity. And making those times in their life tech-free zones is one way that we can help protect our children. We have resources in our advisory that can help parents have these conversations. But the bottom line is we're in the middle of a youth mental health crisis. We've got to do everything possible to help support our kids. That means addressing social media to make it safer.
Couldn't agree more. U.S. Surgeon General Vivek Murthy, thank you very much for coming on the show and sharing this with us.
Thanks so much.
Appreciate it.